and we move on to the physical condition of irritable bowel syndrome.
Yeah, I mean, it's a condition that a huge drain on the economy. It costs the economy about £40 million a year. It's up there with low back pain as a cause of major absenteeism from work.
Really?
Why do you think it's so common?
Well, we don't know the cause. You know, I mean, of the sufferers, about 70% are women. We don't know why. There's no test for it. You know, so we're not sure of the cause. We do know that stress can trigger it. Certain disorders of the immune system can. Certain foods may trigger it in some patients. And I think I should just run through the symptoms,
yeah.
what you get with IBS. And first of all, abdominal pain and cramps, which can be very troublesome. A change in your bowel habit, usually diarrhea, but sometimes constipation. Bloating and swelling. You know, the women, their skirts don't fit. They're 6 months pregnant one day with wind, next day they're normal. Excessive wind down below can be very embarrassing. The urgency to empty your bowels, and it can be, you've got to get there straight away, otherwise it's an accident. And then feeling that you haven't completely emptied your bowels afterwards. The frustrating thing is, from a doctor's point of view, you're diagnosing it on symptoms, we haven't got a test. And one thing I do go on a bit about is, if you have IBS and you're having treatment and it's not helping your symptoms, you may well have celiac disease, which causes similar symptoms. I know, but celiac as well. I'm a walking medical encyclopedia patient. But if your symptoms aren't being helped, ask for a celiac test.
So they can test for that?
Yeah, we can. Yeah.
Okay.
Yeah. And there's also, with IBS, there's a very interesting research just come out recently on a probiotic being used for IBS. Now, this is independent research, NHS funded, no commercial interest, and it was from King's College Hospital in London, where they looked at a probiotic.
So this is like these probiotic drinks that you can buy.
Yogurty
but they always,
drinks.
people always complain about this because they're full of sugar to make them taste nice.
Well, that's right, but this is very different. There's no other product like this with the Symprove.
So this won't taste nice then?
It may not. It may not.
It doesn't smell nice, I'll tell you that much.
What does probiotic do?
Well, I mean, an egg cupful will give you about 10 billion bacteria, but the thing is, these bacteria are resistant to gastric acid, which is like car acid in strength, whereas the other probiotics will be affected by gastric acid, so all the bacteria get through. There are 4 types of friendly bacteria. They attack the bad bacteria, and the research on IBS patients showed that 60% of them had improvement of their symptoms and an improvement in their quality of life.
So
and is this available now?
That's available now.
No
it's over
dairy
the counter.
in
No
this.
dairy.
So what does this do when we throw this down? This puts nice things in our tummies.
Yeah,
Why do you drink that so quickly?
Nice. It's quite lemony and sharp.
Actually,
but I like that.
there's an email just come in from a viewer singing the praise. He says, "This product's amazing. Not only has my IBS symptoms gone, I have also been giving it to my dogs. Both dogs have issues in this area, and it's been a godsend for all of us."
Well,
things that work on animals.
Mango and passion fruit flavour, that one. Did they do different flavours then?
Yes, I believe. Yes.
I obviously got the dog's urine.
Oh, stop it. I thought it was very nice. It was sharp and lemony. Yeah, it was like limoncello.
Well, I didn't mind.
It does you good.
Yeah.
And what would you just, one of those little glasses a day?
Yes, yeah. They recommend, in the study, they said, take it for 3 months to get the real full long-term effect.
So that's all good bacteria.
Yes.
Okay, and we'll put the details of where you can get that on the website. Thank you, Chris.
Thank you, Doctor. Thank you very much indeed.